Welcome, everyone, to Women Talking Wednesday, our virtual Lunch and Learn series presented to you by HealthyHer.life. My name is Rena Carlini. I'm one of the co-founders of HealthyHer.life.
And I'm Joanne Tejeda, and I'm also one of the co-founders of HealthyHer.life. Welcome, everyone.
We're so happy to have you here today. And I want to encourage everyone to take just a quick moment and introduce yourself in the chat. Let us know where you're coming from. This is a nearly sold out event. I think we probably have 3 spots left. And we've got people from various countries, the majority from Canada, but we've got some from the UK and from the USA as well. So thanks to everyone for signing up today. We're so delighted to bring you this informal interview style virtual lunch and learn on the topic of managing weight and nutrition in hormonal health with our special invited guest speaker, Dr. Megha Poddar. Now, before we get into some introductions, we wanted to give you a little bit of background about hormonal health, HealthyHer.life, I should say, before we begin, because many of you are new to this series and this organization. And then we're going to get into the background with Dr. Poddar, and when we get into the Q&A thereafter. A few housekeeping quick things. I see a lot of people from across Canada here, Edmonton, Mississauga, Kitchener, Ottawa. It's fantastic. Someone from the UK already introducing themselves. Welcome, everyone. I love the fact that we've got some global participation today. So, Joanne, maybe we'll just put up a bit of background about HealthyHer.life. Oh, we've got someone from Florida too. Fantastic. Welcome, everyone. I'm sure the weather's better in Florida than it is here in Toronto, Ontario. It's kind of a cloudy, dark November day. So a little bit about HealthyHer.life. We are about a community hub and marketplace that is here to bring you hormonal health solutions designed for you. HealthyHer.life is Canada's first community hub and marketplace for diverse individuals, women as well as non-binary and LGBTQ+, who are seeking trusted, evidence-based health solutions. So based on clinical data to better manage a chronic hormonal health condition like endometriosis or PCOS or perimenopause and the menopause and thyroid disorders, amongst others. These are chronic ongoing conditions that really are disrupting the quality of life for many people. And so we want our community hub and marketplace to help women and individuals get support and trusted health solutions so they can reduce the pain and disruption that is caused by their hormonal health condition, improving their productivity in the workplace, at home, and in the community so they could feel happier and live a healthier life. And you can see on the screen here a CAPTCHA to our website. It's free to join our community. We hope many of you who haven't joined yet will join, and we encourage you all to do so. So moving on next, I'd like to introduce our special invited speaker, which is Dr. Megha Poddar. And the topic today is on managing weight and nutrition in hormonal health. And let me give you a little bit of background to some of the bullets on this page about Dr. Poddar. So she is an endocrinologist and an obesity medicine specialist operating in the Toronto area, broader Toronto area. Let's call it the greater Toronto and Hamilton area. She's also a diplomat of the American Board of Obesity Medicine, as well as being an adjunct assistant professor in the Department of Medicine at McMaster University. Dr. Poddar also serves as the medical director of the Medical Weight Management Center of Canada. We sometimes call it MWMCC. And she's also the clinical director of the LMC Weight Management Program. Dr. Poddar is also a lead author and co-author of many contributed texts that are on the subject of obesity education, including the McMaster University textbook of internal medicine and the 2020 Canadian Adult Obesity Clinical Practice Guidelines. She's very dedicated to mentoring healthcare providers in obesity management and in clinical development, both nationally and globally, and is quite passionate advocate for patients living with obesity. So welcome, Dr. Poddar.
Thank you, Rena. Thanks for having me. And thanks everyone for joining us from all over.
Yes, this is a really full session today. And what we're going to do before we get into our interview style Q&A for today, which is the format that we do these Women Talking Wednesday series, we've muted the people in the audience mainly to make this as efficient as we can in just the 50 minutes that we have. However, we encourage everyone to submit a question as we go through this interview together. And we will be taking several opportunities to pull from your questions throughout the next 45 minutes. So don't hesitate to ask your questions, and we'll do our best to get most of them, if not all of them, answered. Okay. So to begin, and one other thing for anyone who is concerned about privacy, by all means, you could change the name of your display by right-clicking with the three dots on your Zoom screen and click rename, and you could rename yourself, maybe initials or otherwise, if there's a concern for you, because this is a recorded session. And so totally up to you, your level of comfort. All right, to begin, let's start with my first question. Dr. Poddar, what were the reasons that influenced you to become an endocrinologist in your medical career? And then with that practice, focus on weight management and obesity medicine. Tell us a little bit about your journey of how you got here so far.
Yeah, thank you so much for asking that question, because it allows me to kind of reflect on a lot of the different things that sometimes you don't have time to pause and think about. So, I'm a pretty cerebral person. I like math. I like biochemistry. I like ordering lab tests and seeing the results and being able to kind of navigate health through objective numbers and things like that. So biochemistry and hormonal health really spoke to me sort of very early on in my medical school career. I find diabetes, hypothyroidism, PCOS, a lot of these challenges really lead to negative quality of life, and there are treatable diseases. So it's something where I sort of fell into because of my background in terms of liking numbers and biochemistry, but then also seeing the patient in front of me. It's also an area of medicine that you really build relationships, right? So there's a lot of areas of medicine that are kind of in and out in your life in terms of surgery and acute care and hospital. That's not what I liked. I really liked the story and building that relationship and knowing, if something positive or negative were to happen in your life and how it would impact your health. So that's kind of where endocrinology really spoke to me. And then something really interesting happened in my training. I was seeing all these patients, and I was really sort of, treating their cholesterol and treating their diabetes and helping them with blood pressure. But there was a very obvious gap in terms of what we were doing. We were treating all the downstream complications of a very obvious problem when it came to lifestyle modification and weight management. Like, we didn't talk about it, black box. We didn't want to open up the conversation. To be honest, even in my training, there wasn't really anyone there to help me navigate that for my patients. And I kept asking the questions and I kept not getting answers. And that's what drove me to sort of say, there's something here that we're missing. And is there maybe something that I could start learning for myself to see if I can better the care that I'm actually providing? And so in my endocrinology training, I actually went out kind of across Ontario, at least, learning about bariatric medicine. It all started with bariatric surgery programs, because that's kind of all that was there to talk about weight management. And then I started talking to subspecialists. There's a few people in the area. Fast forward now about 10 years later, and it's incredible to see all of these new learners and medical students and residents asking me how they can get more involved. That did not exist when I started. And so, after endocrinology, I subspecialized in obesity, and that's kind of taken me through a full practice. Most of what I see is weight management. There's still a lot of gaps in the healthcare system for how we can deliver care in this space. And so now, you sort of saw in my introduction, I've really tried to translate a lot of my knowledge and experience into creating programs. And so I've created a program within an endocrinology organization called LMC. But the thing that I'm probably most proud of is just over the last 2 years, we've tried to create a program that delivers weight management support across Canada in a standardized way by actually training healthcare providers, dietitians, and doctors on CBT therapy for weight management plus medical treatment. And thank you, Joanne, for putting up the slide. This is just a sort of brief summary of what the program is that we've built. It's called the Medical Weight Management Center of Canada. And I just wanted to highlight that I know a lot of this conversation is often lends itself to saying, well, where do I get support and how do I actually get access to treatment once I understand what treatment is? And that's what the MWM program was really built around. It's providing individualized, personal understanding of why you struggle with weight, what's happening with your body, and what are the targeted treatments that can improve your overall health. A lot of what we also do is move the conversation away from weight loss. So as you all on the line have probably seen, as social media and TikTok has kind of hijacked a lot of the conversations around weight management and obesity treatment to talk about weight loss, when it's so much more than that. And quality and quantity of life is not just about losing weight. In fact, sometimes you can lose weight and that doesn't actually improve the other aspects of your life. So we really want to change the conversation to say, how do we help you feel better? Just like you said, Rena, like what are the things you're struggling with? And what are the things that we need to do to help you improve that? Amongst those, weight management plays a significant role. And so that's all I wanted to highlight about that piece.
I love this. When I learned about the Medical Weight Management Center, which was just when it was announced, possibly a year ago. I know it wasn't even live a year ago. I think it was earlier this year. So this is a very new program. I think it's centered in the Hamilton area, but I know that your programs are offered right across the country.
We're in 4 provinces across Canada at this time, and we're all virtual. So we really didn't want geography to be a barrier for the average person.
Which is, I think, the way healthcare is aiming to go with these specialized care services like MWM. And I think it's such an innovative offering because I know historically when I think about, weight management, other than your typical weight loss centers that we all know about, you tend to think on the medical side about the bariatric medicine specialists, which tend to be for a lot of individuals who are quite obese, almost morbidly obese, and it's a really very strong area of intervention. But what about people who have obesity, but they're still functional, but they really don't feel that they can manage their weight, and it might have been even caused by a hormonal health condition. Take, for example, perimenopause and menopause, which is a typical period where women tend to gain weight, even reducing what they eat, and they're still gaining weight. Personal experience here, and you're just trying to figure out, what am I doing wrong? And it may not even be anything you're doing wrong per se. It's just you've got to take a new approach to the way you handle nutrition with your hormonal condition, and therefore your weight can be better managed. So what I wanted to do now is shift to my next question, which is, let's kind of get everyone on the same level of understanding of how we measure weight and body dimensions, because this is always a hot topic, right? What is considered normal weight? Should we be using BMI or body mass index, or do we go with percent body fat? I know I've been measured both ways, which is right, which is not so good. And how do we use that to track and manage our weight measurements? So let's hear it from you.
Yeah, so, I think there's not a clear black and white answer. The BMI or body mass index, which is a ratio of your weight and height, has been traditionally used. It is the thing that's the most studied. It's the thing that we use on a population-wide perspective. It grades you based on the severity of obesity. The higher the BMI, the more likely you are at risk of having complications to your health because of your weight. The problem with the BMI is it only takes into consideration your weight and height. It doesn't show where that weight is being collected. It doesn't show that, you were potentially at a higher weight before and now at a lower weight, much healthier, but your BMI is still elevated. So the idea is not that you need a normal BMI to be healthy. That's the biggest misnomer and the thing that we've really moved away from. A BMI is helpful as one parameter of your health to understand your risk.
Right.
But what we are really trying to understand is, do you have weight-related complications? Is your weight impacting your metabolic health? That's things like diabetes, blood pressure, cholesterol. Is your weight impacting your mental health? Is your weight impacting your physical or mechanical health? If you have a bigger body and you are at a higher BMI, but your weight is not impacting any of those aspects of your health, then really you don't have obesity. Those are not, just because you live in a bigger weight body doesn't mean that you have a health problem. And so that's why the BMI has sort of fallen out of favor. Also, fat mass and fat percentage, it's also a helpful tool, but it's actually not aligned with health risk. And what I mean by that is full body percentage is actually not a useful parameter compared to fat that's deposited on your abdomen or your stomach. That type of fat is an indication of fat also on your organs. And it's really that fat that we get concerned about. And perimenopause and estrogen deficiency lends itself to having accumulation of abdominal fat. So many people will sort of say, all of a sudden I have this tummy and I never had it before. I'm not changing my diet. I'm not changing the amount of exercise I'm doing. That type of fat is problematic. And that's the type of fat we want to particularly treat.
Yeah, it's absolutely, definitely very common, even for the thinnest of women.
Yeah.
Once they hit that middle-aged years, you're always putting on an extra, easily 10 pounds without even seeing it happen, not understanding how it led there. And so the question there is, when is it a sign of a bigger health concern than maybe what might be happening that's hormonally triggered, let's say?
Mm-hmm. So once the weight is impacting your health, that's when it's a concern.
Okay.
Also, though, there are 3 time periods where I recommend seeking treatment.
Yeah.
Okay, so this is really if your weight is going up and up and up, and you're managing the way that you can with controlling the things you can around lifestyle, but your weight's going up, we need to get treatment early because we don't want you to struggle with health conditions and then we treat it. We want to prevent those conditions from happening in the first place.
Yeah.
If you are trying to reduce your caloric intake, the amount that you're eating, and you're starving, you're hungry all the time, you're thinking about food all the time, that's a real biology-driven phenomenon. And so that needs treatment. And lastly, if you're, regardless of your weight, if you're starting to see your sugars are rising or your blood pressure is going up, get on top of it early before it's a problem.
Okay, these are great tips. So anything that is sort of deviating from a normal level weight, whatever that weight happens to be, and it's disrupting with your activities in your life, making you less mobile, making you feel tired just going up a flight of stairs repeatedly day after day, you need to seek some type of intervention. I have a great question about, okay, where do they get help? But before, and so hold that question, because I'd love to take an opportunity right now for an audience question. Joanne, over to you. Is there a question in the chat that we could take?
We don't have anything in particular regarding weight management and metabolism. Oh, I see something here. Okay, it talks about what is available to keep these services affordable and accessible for women, but I think that kind of ties into the question that Rina's going to be asking next. So
yeah, so maybe it's a double question, a part
Yes.
1 and a part 2. Thank you for that question. So first is, if they're feeling that they're seeing these indicators that they need help with managing their weight because there's rapid weight gain. For example, patients with polycystic ovary syndrome, that's one of the clinical presentations of that, and typically happens with young women. They'll gain weight 5 or more pounds, even 10 pounds every year, and it's not growth related, it's something else. or it could be in the menopause transition or sign of a thyroid disorder. And like you said, it's disrupting their ability to participate in work and life. Where should they go first to seek help, and maybe even beyond their family physician, because that is, that we know, a first point of contact, but sometimes it's helpful and sometimes it's not. So where can they go elsewhere? And then we'll answer the part 2 question.
Yeah.
About. Okay.
So I think in order to understand where to go, we need to know what treatments are available. What would be the recommendations? So where you go is depending on what you're trying to accomplish. What the healthcare system does not provide well is lifestyle support, right? So if you're looking for support around, why does my brain think about food all the time? How do I handle cravings? How do I get motivated to be more active? The how and the motivation and the support to be guided on behavior change. Typically that's done honestly outside the healthcare system.
Right.
Programs like MWM was literally built to fill that gap. It's a virtual appointment every 2 weeks. You need to be seen very often for the immediate time when you start engaging in treatment for behavior change, because a lot is happening. There's problem solving happening. There's a lot of understanding around where you're starting and where you want to go. When we talk about medical treatment, there are medical treatments, including hormone replacement therapy, depending on what you need. There are medical treatments for PCOS, but there's also medical treatments specifically for weight. And so who can you approach to do that? Many endocrinologists are sort of specializing and able to help with those type of treatments. Certainly for hormonal health, a menopause specialist, which is either an OBGYN or endocrinologist, is typically one to help. I'll put a shout out to Obesity Canada. On Obesity Canada's website, there's a physician locator. These are people that have specifically said, hey, I'm here to help in terms of the conversation around obesity, because what I know happens is there's a lot of stigma and bias in this conversation. So many healthcare providers that you might ask the question and seek help to may not be able to help you, and they may also hinder, the conversation, because there's a lot of, well, just diet or eat less food, and it's not helpful. So if you want to go to somebody who you know is going to be helpful, Obesity Canada Physician Locator is the way I would go. For behavior change, I do think that typically you have to go outside the healthcare system, but I would strongly recommend researching who's behind the service that's being delivered, because there's a lot of noise out there.
That's right.
So you just want to be careful.
And so related to the part 2 question, which came from our chat board, what's available to access these services beyond the healthcare system and make them even affordable, because they're not reimbursed or insured services from the government. Maybe you can address that, and knowing that you're getting a qualified physician guided or registered dietitian guided service.
Yeah, so I think times are changing in terms of access to these things. Part of my career mission is that we are able to open up access to these treatments eventually under the provincial healthcare plan. Right now, that's not typically what it is. The dietitian component of the program, and it's not always a dietitian. Sometimes it can be a health coach, it can be a pharmacist. The allied healthcare team that supports the physician conversation is often a paid for service, but insurance and employee health plans do cover a lot of these services. Right. So that's where some of the access can kind of be driven from. Right. A lot of the academic centers or hospital-based programs have funding. So if you're somebody that is unable to sort of access these on your own, you may want to consider hospital-based programs. They are harder to get into, and there's longer wait lists. And of course, there's other barriers, but there are some tools out there. A lot of bariatric surgery programs have a medical component. They have a medical program that's funded under the government. So there is some access, but I'll be the first to say that we're strongly lacking, and advocates like yourselves are what we need to increase this conversation. Most of the time, employer plans are going to be the individual way to improve them. naturopaths, pharmacists, there are lots of different allied healthcare support that can support the conversation though.
Yeah. No, and this is great. I mean, it always starts with one really great innovative program like the MWM, or Medical Weight Management Center of Canada. And of course, then the rest of the competition starts to come in. But I still think you want more of these offerings than none of these offerings, or just one, because this is a widespread problem that concerns so many people, individuals, different age groups. And by the way, I should have mentioned, although this series is called Women Talking Wednesday, I know that there are many men and other non-binary individuals who don't identify with the term women, who are very, very interested, and they are clients of MWM and seeking, information of how they can get this help. So today, this topic really crosses, kind of all gender descriptions at this point. So I just wanted to put that out there. And Joanne, if you have a moment, I wouldn't mind if you could just put the link to the MWM website as well in the chat. And also, more important, Megha, you talked about Obesity Canada. So people can find a physician in their corner of the country, hopefully. So Joanne, when you have a moment, if you could put that link as well in the chat, and maybe people can go check it out during or after this event. Now I see a few more questions coming, which is great because we will get to them, I promise you. But I'm now going to come with one of the hot topic questions around this area of obesity medicine and weight management. Let's talk about the various treatment approaches that are clinically approved and available in Canada for managing weight and obesity and improving metabolic health in general, especially if you're pre-diabetic or diabetic. So one of the most talked about are the therapeutic drugs. It's out there every day in our faces. And these are, really wonderful drugs in many cases, but, we're hearing the pros and the cons, and it's making people very nervous, excited and nervous, right? Yeah. So let's talk about the GLP-1 agonists, or like semaglutide, which go by the trademark names, brand names of Ozempic or Wegovy in the US, which are approved for the treatment of type 2 diabetes initially. But in 2020, I believe Ozempic was approved for treatment of obesity. Then there are other drugs like these opioid antagonists called naltrexone, combined with a dopamine reuptake inhibitor like bupropion. I think I pronounced it well. They come together. They're called Contrave. I've seen a lot of advertising about Contrave. So these are the new therapy drugs for obesity medicine, obesity management. Can you tell us about the benefits and the risks as you know it with these two classes of drugs?
Sure. So I think in order to understand how these medications work, we have to understand the basics around why obesity is a chronic disease. So we now know that weight is a disease state within itself. Why is that? It's because, the problem with obesity is actually centered in the brain. And it's centered in two different areas of the brain: the appetite system in the brain, hunger, fullness, and the reward seeking area of the brain. We don't eat just because we're hungry. We eat because of pleasure, reward, right. Food tastes good, makes us feel good. It's these two areas of the brain that whenever we are, trying to engage in healthy behaviors, eat less calories, go on a diet, yes, we may see some weight go down, but then our natural system, our natural biology is to regulate the highest weight. What that means is weight loss is bad from a survival perspective. Our brain mechanisms change. Our hormones that regulate appetite in our brain change. GLP-1 is one of those hormones. So when you lose weight through diet and exercise, your GLP-1 naturally goes down. Then you get physically more hungry. Not only that, but reward seeking from food goes up. You think about food way more often than you did before. All of these things are subconscious. It's not like you're thinking, oh, yes, I'm thinking about food more often. It's happening in the background. You don't even realize it. This is the chronic disease of obesity, meaning that yo-yo dieting is normal. When you lose weight, your body's going to try and get that weight back up. 95% of the time, it will succeed. That's why these medications work. GLP-1, they work on the appetite system of the brain. They help you to keep yourself feeling less hungry, even though your weight has gone down. So yes, they do suppress appetite, but that's not the only way that they're working. A lot of people will say, I'm not hungry. Like, that's not actually my problem. But when you restrict your calories and you reduce your weight, you will be more hungry. And that will be the problem. And that is why your weight goes back up. And so that's why these medications work. Contrave works on reward. It helps you to stop thinking about food in the background and cravings and that sort of thing. So that's how they're working. There are risks and benefits to everything we do. In order for you to be safely prescribed a medication or safely have bariatric surgery, the benefits have to outweigh the risks. Now, for the most part, the GLP-1 receptor class of medications are safe. We've been using them in the diabetes treatment for over a decade. GI upset or nausea, vomiting, diarrhea are common. This is when you first start it. It's mild. If you're prescribed it properly and monitored properly, very, very few people actually have to stop the medication because of those side effects. There are rare side effects that are severe, but they're very rare. Pancreatitis and in animal studies, a rare type of thyroid cancer. Those are important to talk about because if you have a risk of those things, you might be at greater risk of these medications. But in general, the risk of weight and keeping the weight and not treating the weight is greater than the risk of these medications. Two important points. Ozempic is not actually approved for weight management. It's Wegovy that's approved for weight management.
Okay.
So I'll just shed light on this because it's a common misconception.
Different manufacturers?
Exactly. Different brand name. All it is a different brand name and different dose. So Ozempic is approved for diabetes. It's semaglutide at the dose of 1 milligram. Wegovy is approved for weight management. It's semaglutide at 2.4 milligrams. So Wegovy not yet available in Canada, coming next year. Ozempic available. That's why it's being prescribed, because it's the same as Wegovy, just different name.
Different dose. But it is being used for
it is
weight
being
management,
used,
even though it's not approved?
Exactly. So it is
Off-label?
approved. It's approved because it's the same molecule. It's just a marketing conversation. We don't have the pens that say Wegovy on it, but otherwise you're essentially getting Wegovy, even though it says Ozempic. So the reason why it's being prescribed is because we need treatment and people deserve access to treatment, even though we don't have a pen that says a certain name, but it causes problems with cost and coverage and insurance plan coverage. So that's where the barrier comes. My last point around medications is that the question's going to come up, do I need to stay on them? How long should I be on them? And if we acknowledge, accept, and understand that obesity is a chronic disease, we understand now how it works and why it works, it lends you to understand that you do need to stay on them because your biology is not going to change after treatment. That problem is always going to be there.
Right. And I have heard anecdotes, mind you, that some people who have gone off these treatments, these semaglutide or GLP-1 agonists like Ozempic or Wegovy, have then experienced back what they were before they started the medication. Have some gained their weight, and so
that's expected.
Right? And so they really do need to stay on it long term.
It is the same as saying, I have an underactive thyroid. It doesn't work anymore. I'm taking a thyroid hormone to regulate my thyroid and regulate my system. And when I stop that thyroid hormone, my thyroid doesn't start to work normally again. It is still going to be underactive. And it's the same conversation with these medications.
Why it's so important to have some level of insurance for this type, because it is a chronic condition that for some people that needs, a good adherence to this medication. So hopefully sometime in the very near future, we will have some level of insurance for these, because they're not inexpensive drugs too. Can you quickly comment about right now the cost of that drug?
So Ozempic at the 1 milligram dose is about $250 a month. Saxenda, which is a similar medication to Ozempic, but a daily injectable versus Ozempic is a weekly injectable. Saxenda is $450 a month. Contrave is $350 a month. So they are not cheap. And then I just want to make one other comment about these medications and
Mhm.
behavior change,
Mhm.
because a lot of people are, sort of think, oh, I just need the medication. I just need the medication.
Yeah.
And if you don't have access to the medication, then it feels like futility.
Yeah.
Like if I'm not going to be on the medication while I'm not getting treatment, what am I supposed to do?
Mhm.
This is where the conversation around behavior change is so valuable, because I'm
Right.
not talking about diet and exercise.
Yeah.
I'm not suggesting you go on a meal plan and you do a food diary and you calorie restrict.
Mhm.
You've done that.
Mhm.
If you're struggling with your weight, you've done that. We've all
Mhm.
done that at some point in our
Mhm.
lives, right? So
Mhm. Mhm.
the idea behind behavior change is very different. It's
Mhm.
understanding what are the triggers for my cravings. It's
Yeah.
understanding, what is going to motivate me to move my body more. It's not going to be
Right.
weight loss. It's going to be
Right.
something else. And what is that? And how do we peel back the layers of negative lived experience with weight? People don't treat us very nicely when we live in bigger bodies.
Yeah.
How is that impacting us? And how is that making us change our decisions about what treatments we want? It's
Yeah.
all of that kind of heavy stuff that a medication is not going to treat that stuff.
Right.
And so that's the reality around the behavior change piece.
Right. That whole holistic approach to managing your weight with medication, cognitive behavioral therapy, some nutrition coaching, and of course, it's good to move every day.
Yeah.
It's good to even just do that 30-minute brisk walk. You don't have to do a major workout all the time. Sometimes a good aggressive movement is good too, but even that daily brisk walk is the starting point for everyone. Okay, this is another great time to pause and take at least a couple of questions from the chat board. Joanne, I see a few of them here, and I'm not sure if you
Yeah.
had a chance to pick a few, but
Yes, I see a few of them, and I think there was one that you kind of just answered right now, talking about the differences between cognitive behavioral therapy and medication and how they're used differently when it comes to obesity management. Another question that came here on the chat, perhaps you can give us your thoughts about it, is do you have any approach or comment about weight management during menopause? And throughout your research or throughout your practice, have you seen any evidence for hormone replacement therapy being helpful with weight management?
Awesome question. I'm just going to highlight the CBT question just because I want to make sure I answer it in its entirety. One of the realities around weight management is the medications don't work without the behavior change. Behavior change often doesn't work without the medication. The medication is treating the biology. It's allowing it so that your appetite is suppressed, so that your brain's not thinking about food all the time. But the behavior change is actually implementing the day-to-day. If you are hungry all the time and thinking about food all the time, it is very difficult to engage in behavior change and be successful because you're not treating the biology. If you're just treating the biology, you're not going to be able to manage cravings and vacations and high-risk time periods. So just sort of say they are kind of working together. They make both together make it possible. One alone makes something missing. There's a gap there.
Right. And that much more challenging. So the CBT is a very important component. And I know your program with medical weight management does provide the CBT coaching. It may or may not, a client may or may not even need the medical intervention,
exactly.
but they will at least start with the CBT and potentially the nutrition coaching, if it's deemed that their nutrition and food choices are not, as optimal as they could be. I hope that answered the CBT question that I saw in the chat board, because I know how important that question is for so many people in many areas beyond weight management, but certainly we haven't associated it historically with weight management. It's always been, just kick in high gear and work out every day, like a maniac. And you can't always do that. It's not always practical, especially with our long winters these days.
Yeah. And now the conversation is just take this medication. And I also
Yeah.
think that's completely inappropriate too.
Exactly.
So let's talk about menopause, because I think this is a really important one too.
Definitely.
So menopause is a high-risk time period for women. They will typically gain weight around their abdomen. That's the bad weight that causes many other health issues. Every single woman will go through menopause. This is the biggest challenge of for most adult women, because it's a time period in their lives where if they are working, they're typically at the peak of their careers. They are in a situation where they may be having finally an ability to do things for themselves if they're taking care of young children. It's a very interesting transition time from an age perspective in their lives, where they are now dealing with estrogen deficiency, which is normal, but causing hot flashes, sleep disturbance, mood irritability, and weight gain. Like that doesn't sound so great. So what can we do to support these women? This has traditionally been very poorly done for a few different reasons. Hormone replacement therapy was initially being prescribed pretty liberally, and then we had data that came out that suggested that it was bad. It was causing heart disease and breast cancer in women. So then it was completely stopped, and women were really left with not very much. What has now come out is we understand how hormone replacement therapy works much better, and we understand the pros and cons, and we understand that it's safe and often better for a person to be on hormone replacement therapy instead of not. So like the times have shifted. When it comes to weight, what hormone replacement therapy does not do is cause weight loss. That we know for sure. What it has been shown to do in some studies is it can prevent significant weight gain associated with menopause, and it can decrease the amount of weight that gets established on your stomach.
Right.
So there is a benefit from a metabolic and weight perspective with hormone replacement therapy, but what we don't want to be doing is telling people go on HRT and you won't gain weight associated with menopause. It's just that it might mitigate some of the problems that you have without going on HRT. I personally think the biggest benefit of treatment during menopause for weight is actually all the other things. Poor sleep increases weight. Poor sleep increases cravings. Poor mood control causes problems with behavior change, decrease exercise. So if we can treat hot flashes, if we can make sleep better, if we can treat mood, and HRT does most of those things, in my opinion, the transition will be easier. And we're supporting our patients and our clients to have an easier transition. It's actually not the menopause that's causing the problems. It's all of the aspects around the transition. So that whole sort of holistic conversation, all of those things make a difference in your weight. And so it's not a like prescribe HRT and weight's not a problem. It's actually, we kind of have to deal with all the symptoms of menopause. People who live at a higher weight body, have obesity already, they have worse symptoms of menopause. So this patient population is already vulnerable to having complications of weight. They're going to be even more vulnerable to having challenges around this transition time period.
Yeah, absolutely. That's kind of understandable as well. There's a question here that I'd love to get answered. And somebody asked, do GPs, or I guess your family physician, make referrals to endocrinologists? And sometimes, you know, we in all reality, we encounter barriers. I know family physicians are really overworked and overburdened, you know, being the quarterbacks of our healthcare. And it's tough sometimes to get referrals because specialists, particularly endocrinologists, are not a popular, you know, they're not well populated across the country. They tend to be in a lot of major centers. And I know I've asked you this question, why are, you know, some of them specialized, well, a lot of them are specialized in diabetes versus weight management like you're doing, or perhaps areas of hormonal health like PCOS or menopause. So it is hard for the family physician to do these referrals when they have so much demand for an endocrinologist. So can you comment a little bit about that? Where a person should go first to get a referral to a suitable endocrinologist for weight management, and what should they do if their family physician isn't answering their questions?
Yeah, it's tough because you're right in that to see a specialist in Canada, you need a referral. So you can't just call someone up and go to their office because you need the referral. Where can you get the referral from? To be honest, it should be from your primary care doctor.
Right.
What I would say is that the tides have shifted in terms of us advocating for ourselves now and figuring it out for ourselves, and then presenting it maybe to the primary care doctor to say, here's what I've seen is that this doctor specializes in menopause or PCOS. Are you open to referring me to this specific physician?
Right.
Because honestly, endocrinologists are human beings too. And I'm totally part of this problem, because I also don't see a lot of people for general endocrine reasons. I'm focused on obesity because my program supports obesity. I'm sort of able to provide the resources for obesity, whereas another endocrinologist can't. But then when you get referred to me and you're for a different problem, then I'm not the right person to see. So I do think that there is a little bit more we can do to sort of highlight what areas we are specializing in. I will sort of share LMC. That's the endocrinology group. That's the largest endocrinology group in Canada that I'm one of the endos for as well. On the website, we pretty much, in our bios, it explains what we are passionate about and what area we're interested in. So that could be a good way to start. But all I will say is a family doctor needs to send a referral. If you can do some of the legwork to say, this is the person I want to see, does that make sense to you, and have a collaborative conversation? That is probably the way to get yourself one step closer, instead of relying on the family doctor who may or may not know, exactly the right person to send you to.
Yeah, no, that's great. And I'm wondering, do you happen to know offhand, you probably do, a place, whether it's Endocrinology Canada, I'm not sure what it's called, to go and access, a list of physicians with different specialty areas, other than, an already established clinic. You did mention LMC specialists. And so I'm not sure if Joanne is able to just put that link there, but is there just a broader society of endocrinologists that we could find that information from?
Actually, I don't think so.
No,
Interestingly, like we're all part of the Canadian Society of Endocrinology and Metabolism, but there isn't like Obesity Canada physician locator that's similar, unfortunately. But it's a good point to kind of take back, because obviously that's what Healthy Her is probably one of the mandates, is trying to improve that conversation.
Trying to improve access. In other areas that we've talked about, such as in menopause care, they're starting to have much more. I mean, there was traditionally always the Society of Obstetrician and Gynecologists of Canada, but now we have the Canadian Menopause Society, we have the Menopause Foundation of Canada, we have many other resources to find those specialists, because it is not easy. And I know it's the same as well with weight management, where you should be seen by, in my opinion, by an endocrinologist, somebody who is really well versed and practiced in that area. So we'll try to find a few more, and we will certainly put it in the emailers out once we send this video recording. But I see Joanne has already put some very helpful links right there. I'll be open. I'm not doing a formal plug for LMC, but I am a client of LMC. I'm being open and honest. I actually have a hypothyroidism condition. It sort of appeared in my part of my perimenopause, which they often come with these other hormonal conditions. And, I agree with you. I was actually quite surprised at how many different endocrinology specialists there are in LMC. And I think it's right across Canada. I know there's many locations in Ontario, but it's right across Canada as well.
Exactly.
So it is a really great starting point resource for those of you who don't have anywhere to go and don't know where to look. All right. I think just looking at time, we're just about wrapped up here, but I'm wondering, Joanne, if we could do 2 questions, one of which will be mine as a closing question for Dr. Poddar. But before I go there, is there one other question we could take from the chat?
Yeah, so I know I've seen a few questions here, and I know Dr. Poddar commented on weight management for women that are going through menopause, so at a later stage in life. And we also had a question here regarding women, at a younger age that might be afflicted with another hormonal health condition, like, polycystic ovary syndrome or endometriosis, which we know that sometimes can cause a hormonal shift and can lead to weight gain. And so if you have any comments there for our audience.
I mean, so with PCO, the PCOS guidelines, the International Consensus of Guidelines just came out 2 days ago, interestingly. So worth looking at, and we can kind of send that out to the audience too. But interestingly, there is no specific nutritional recommendation for PCOS in terms of improving outcomes with reproductive health, fertility, or weight. So when it comes to nutrition, it's not a specific diet that necessarily has shown to improve outcomes. Although in general, we know lower carbohydrate is better for insulin resistance. Essentially, it's whatever diet or nutritional plan you can stick with and consume the least amount of calories while still enjoying life and still sort of being able to maintain long term. There's no specific diet that's recommended across these health conditions, interestingly.
Yeah.
The second piece of it is that any hormonal shift is going to lead to a shift in your body. Our bodies are not static beings. Whatever you did before that hormonal shift, before that inflammatory reaction, before whatever the trigger was, whatever you did before may or may not work now. So this is just a plug to say it's not your fault. There is something you can do. It's just that that something is probably different from what you've been doing in the past. In general, the more physical activity that you can do is the most effective way to keep your mental health, sleep, and prevent weight gain. Just being physically active is not an effective way to lose weight and keep it off. We know that it's been shown that time and time again, but physical exercise is a determinant for weight gain and menopause. So if there's questions around how do I prevent this weight from ever coming on, the more lean muscle mass you have and the more physically active you are is the best predictor of the amount of weight and challenges you're going to have afterwards. So I think that there's two sort of things to highlight and take home points is when you have this shift, when something happens where your hormonal balance is off, the idea is to re-engage with nutritional behaviors and physical activity in a way that's different from what you've perhaps been trying before. Seek help to do a full metabolic panel and gauge your risk early so that you can prevent complications down the road. And the last one is try your best to be nice to yourself. I think a lot of us kind of internalize that shame and feel really bad about ourselves when we have something going on. It stops us from seeking care. And it also makes everything a little bit worse. Like when we internalize it and believe that we are horrible or we're obviously not motivated enough, we're not doing the right thing, it deters our success to actually being able to do what we want to do. So that piece needs, like, women need to be lifted up to sort of know that there's help and support out there. And it's not like just deal with it on your own because everyone goes through it.
That's right. You beautifully answered my last question, which was what advice you'd give to any person as a preventative health measure.
There you go.
So they can better manage their weight and overall health. And you gave it right there. So to recap, try to get into a habit of regular physical activity. It doesn't have to be strenuous, but like you said, anything that builds that lean muscle mass, super important for your general overall health. But start with a daily brisk walk. I like to do mine first thing in the morning, actually, if I can, although these darker days make it a lot harder. But
I bet if you didn't do it, the darker days would be even worse.
I feel terrible on those cold, rainy days when it's just too much to go out there. But it becomes habitual. They say if you do it 21 days in a row, it becomes habitual. Like you just can't not do it. As you said, sleep, making sure you have good nutrition, and noting when you are feeling, less happy and having some mood disruptions, that it's time to seek help and getting kind of a handle on that with specialists, not necessarily only endocrinologists, but with other allied health professionals, like you said, people who can coach on mental health, on nutrition. And, that's a lot of what's packaged into your program at Medical Weight Management Center Canada. So thank you, not only for speaking to us today and sharing all this fantastic knowledge. We're going to have you back again, because I know this was one of our most popular topics of this series, but also because we need more people hearing about your center. And I hope, in the not too far future, we'll see more of these medically guided weight management, obesity medicine and nutrition counseling centers, because I think we all need this much more than ever now. So thank you to everybody. I think we just, as an outro, we have a couple of little things we want to talk about with the Healthy Her Life community very quickly. It's free to join our Healthier Life Community Hub. We really want to build this community of conversations and women sharing, advice and supports that they know and they've heard from events like this with our distinguished invited medical speakers like Dr. Poddar. Hopefully we'll also have Dr. Poddar back again in 2024 to give a part 2 of this topic. It was super informative for me and probably many others as well. So click the CAPTCHA if you want to sign up and join. And then finally, our next event, we're not going to have a Women Talking Wednesday in December. Too many things going on with the holiday season. We'll start it up again in January or February, not yet sure, but it'll be for sure by February at the latest. And what we are doing is with this community hub of members, we have something called Women Talking with Trust, our community circle, just for members only who are part of our hub, to have an informal evening conversation. The first one will be December 18th on Monday evenings. It'll be always Monday evening, once a month, 7 to 8. Get together, talk about the hormonal health topics of concern for you, whether it's about endometriosis, weight gain, PCOS, thyroid, perimenopause, and menopause. And women work best, especially to share insights and tips with each other. And this is how we get the health solutions that we need, that holistic approach. Of course, we always want it to be trusted and evidence-based, which is why we feature fantastic doctors like Dr. Poddar on these Women Talking Wednesday webinars, which are open broadly to the public. This Women Talking with Trust community circle is just private for our members online. So I encourage you all to check it out, and I hope to see you on December 18th. And for all the rest, thanks for joining us today. I wish you all happy holidays coming up. They're just around the corner. And with the temptations of food, don't deny yourself that piece of chocolate cake, because I know I won't, but try not to have a second piece. We just all have to, like you said, don't punish yourselves, but, get the coaching and support that you need with the links. You'll get the video recording today and the links as well. And get yourself that help and support to navigate through the holiday season and well into the 2024. Thank you again, Dr. Poddar. This was wonderful.
Sure.
It was great.
Yeah,
Thank
thanks
you,
for having
everyone.
me. Thanks for participating, everyone.
Yeah, thank you
Wonderful.
all.
Thank you. Take care, everyone.
Bye. Take care.
Bye-bye.
Bye.